Good morning, everyone, and thank you for joining me today at the MedComms networking event. I'm here to talk to you today about global medical education and commonalities and differences across the globe. My name is Celeste Kolanko, and I am the Managing Director of PCM Scientific. PCM Scientific is a CME provider located in London, and for disclosure purposes, from a financial perspective, we receive grants and arm's length funding from pharmaceutical companies for our medical education programs. So today I wanted to talk to you about global medical education and first ask the question, does it even really exist? So if we look at the scientific method here, one size does not fit all, and that's really what happens within global medical education as well. While there are some commonalities and things that are similar across the board, across the globe, across the world, it does not work for everyone, even though sometimes people would like to try to fit things into that box. So the question I would ask is, are there really any commonalities across the globe? And when you examine this and look at this a bit, we'll find that there are a few, but actually very few. So when we look at education for the healthcare professional, what are some of the things that are important for healthcare professionals everywhere? Well, obviously they need to stay current with medical information and the medical information trends. And this can vary from area to area, country to country, even region to region, based upon things like the latest scientific trends or the latest inventions or procedures. But it can also go as far as just what do we need for our own community health care and the very, very basics, and keeping up to date on these trends as well. But that overarching need is there, no matter where a medical professional actually practices. The other things that are commonalities here are there's an opportunity for the following: for engagement between different types of healthcare professionals, different types of educators. It's an opportunity for self-awareness. So the healthcare professional has the opportunity to sit back and say, what do I know? What do I not know? Where do I need to go? Where do I need to improve to be able to ensure that I'm practicing to the best possible ability? Improvement. This is an opportunity to say, where can I improve? What do I need to do better? I'm practicing this way now. Is there anything that I can change that will be of better benefit for my patients? And as I mentioned that word change, again, medical education, the medical field is always evolving. What do I need to change? What should I change? What do I want to change to ensure that I'm treating my patients and getting the best patient outcomes? And when we look at the WHO's mission statement, one of the things that they have actually pulled out is that no matter what the healthcare professional is globally, their aim should be to improve patient care and public health. So those are the overarching goals that are the same no matter where your education is on a global level. So that's really probably where most of the similarities end. Now we want to talk about what are the medical education trends across the globe. So there are actually when we look at medical education right now, it's really divided up into four kind of distinct pockets, and because of time today, I'm really going to kind of give a very brief overview on these four different areas. So we look at North America, we look at Europe, we look at the Asia Pacific region, and we look at emerging markets in general. So I'm going to touch on each of these a little bit on an individual basis. So in Europe, Europe is a very interesting continent. We have differences in Eastern Europe and Western Europe. Some people look, because of the size of Europe, as kind of a one large country, but forget that Europe is really 50 distinct different countries, and many times even those individual countries are broken up into different regions and areas and have different needs and have different standards that they're looking for. CME is becoming more and more popular throughout Europe. Some countries require it, some countries do not. There are multiple accrediting bodies, medical societies, and different types of providers that are looking through all of this. There's a global transparency movement that's happening throughout Europe. So EFPIA has set up a common framework for transparency, for reporting of funding to any healthcare professional. And this really took effect as of June of 2016. So it's still in its infant stages as it's rolling out at this point. Interpretation, while EFPIA would like to have a very global overarching framework here, the interpretation really does vary from country to country. And you'll even see that because the pharmaceutical companies are required to do the reporting, it's really dependent. They're all still figuring it out and have different interpretations from different funder to different organization. So not only are you working through the mires of the regulations amongst all these companies, but anyone who's supporting or funding any type of medical education, be it CME education or be it branded or promotional education, has to figure out how to navigate through all of these challenges with the transparency reporting. And from a personal note, when you're talking to your faculty, trying to explain that further to your faculty, your speakers, your KOLs for any of your programs, that's very important, and that's a challenge that we're facing these days. There's different types of delivery and formats. In Europe, the live format is still very, very popular with conferences, congresses, symposia, the opportunity for people to get together like we are today, to network, to talk, to learn from each other. Also, like today, while we're doing this in a local environment and in a group environment, we're also taping this and we're putting out this webcast to a wider audience. And that is becoming more and more popular from an e-learning perspective, an online perspective. People are much more comfortable using these types of environments. The availability of educational activities kind of builds on that delivery and format, because some areas do not have as great of availability to the live types of events, so online is becoming more popular. There's also significantly more funding for education that usually comes within the European Big Five countries, such as Germany, France, Spain, UK, and Italy. So those programs, live programs, tend to be more popular there, but that information and education is still very, very valuable. So we're seeing a lot more of repurposed education going out to all of the European community. One of the areas there, localization is very, very important. So making sure that if you're going to your audience in a country, that first of all it's translated into a local language, but also after the local language is also to ensure that there are any guidelines that have to be interpreted in that area. And finally, we're looking at the difference between CME or certified medical education versus what we would consider promotional education. And when I say promotional education, I mean that this would be funded a product-specific type of education that would really help to ensure proper use of certain treatments, drugs, procedures. Before, several years ago, this was really kind of very blended together. The lines were very, very blurred as to what was promotional, what was really kind of arm's length medical education. But the movement and trend has to become to separate this more and more, and you have your CME providers, which can be private providers like the organization that I work for, or societies or medical organizations that are providing certified medical education, which is fair, balanced, non-promotional education. All funding is at arm's length. Or then we have the traditional medical education, which a pharmaceutical or device company would fund to ensure the promotion and the proper usage about their product. So all of these things are happening and changing. These are the trends. I have been working over here in Europe for the past 4 years and have seen great advances and changes even in that very short period of time. And I think with the introduction to the transparency movement, we're going to see even greater and more interesting things coming along in the near future. I'm going to move on to North America and talk a little bit about North America. And I'm kind of, in this case, speaking a little more directly about the United States, but I am going to include Canada in there as well, because there are a lot of similarities between the two countries over there. In North America, we have what's referred to oftentimes as the Sunshine Act. So this is also a transparency agreement, which is very similar to what I just spoke about that Europe has just enacted. But what we have found with the Sunshine Act reporting was everything that was being reported, all types of payments, except for there was an exclusion for CME and accredited medical education. So if you were running an ACCME accredited event or activity, that has been excluded from the Sunshine Act reporting. Now there's been some discrepancies around that over the last few years and whether or not that should be in place, and yet again many of the pharmaceutical supporters are choosing to make decisions to in some cases report whether it's a certified activity or not. But the AMA, the American Medical Association, which hands out the majority of the credits for ACCME accredited activities as of March in 2016, have said that the exemption still does apply, but yet again it's left up to the interpretation of each supporter how transparent that they want to be. So this has actually made some interesting changes between funding within CME and promotional education in the United States in particular. It has been seen an uptick for accredited medical presentations and programs because of less challenges with having to deal with the systems for reporting. But I think that again, this is still in its infant stages, and what really happens here will left to be determined. As I mentioned in North America, there is a clear distinction between CME and promotional education. The ACCME is a large body that accredits providers that are able to give out the AMA, the American Medical Association credit. But at the same time, there are multiple other types of credits that can be received. And there are nursing associations, there's the credit for the family physician or general practitioners, there's pharmacists, there's dentists. So the whole process of accredited education has been around for a very long time in the United States and in Canada. And there are a variety of different types of credits, and this is a very commonly understood separation between the two. North America seems to be pushing the boundaries in the types of education that they're providing. More traditionally in Europe and other parts of the world, you will see kind of what I'll term siloed education. So specialists only attend presentations and work with specialists. Nurses only attend nurse types of programs. Family physicians or internal medicine people, general practitioners work within their group. But this is changing up quite a bit in North America, where they're really looking at what we're calling interprofessional education, bringing all the teams and groups together, looking at multidisciplinary education, and again, pulling these different types of healthcare professionals together to learn together, to share best practices, to increase dialogue and communication so that ultimately there is the best patient care. And on that note, patient and community involvement is becoming important. So when you're looking for a large education program, not just looking at what the doctors are doing, but looking at all the healthcare professionals, plus talking to patients. What are their true needs? At the end of the day, medical education means that healthcare professionals, doctors, are doing the best thing to get the best patient outcome possible. Well, therefore, why are we not talking to the patients? And that's the question that has been asked. And more, these programs are including patient community involvement, the teacher, the fireman, the police officer. How can we get all of these groups together to really create education programs that don't just give us a little bit of knowledge about the latest and greatest treatments, but really how are we working together to improve overall patient health care? Asia Pacific is a fast-growing market from the medical education space. There is definitely an increased demand in the Asia Pacific region for online education for a variety of different reasons, and some of those are cultural and some of those are practical, just purely because of the size and scope of some of the countries and areas that we're looking for, and for all of the types of new technologies that are available more readily, kind of cheap and easy at this point in time. But the drive for medical education in the Asia Pacific region are really coming from a few different really core drivers. So there is definitely an evolving healthcare infrastructure that probably didn't exist 10, 20 years ago. It's evolving and changing very rapidly. And then there's a growing patient population in Asia that are suffering from various different types of diseases. And there's really just a dramatic rise in cardiovascular disease and certain types of cancers, and seeing this in particular in India and China. And consequently, there's great demand to learn about all of the different treatments available or that could possibly be available for patients. And there are a great deal of presence of societies and hospitals. It's very, very prominent. So working within a medical education program, in most cases, if you're working in Asia, you do have to align yourself with one of their medical societies or a hospital. And if this, especially for the delivery of the education. And again, if a hospital or a society is promoting and supporting and delivering this, the uptake on the education is quite high. And finally, I'm going to speak to you a little bit about emerging markets. There has been stated that there's really a global healthcare talent gap. So there's a lot of people with needs, but not a lot of healthcare professionals. And the WHO quote up here, I'm going to, bear with me, I'm going to read it, but it says, the WHO predicts the crisis will only worsen in coming years, but that may underestimate the potential impact of new e-learning technologies to enable low-cost medical training at scale. Many universities, government, healthcare agencies, NGOs, private companies, and doctors around the world are embracing such technologies, and sometimes with very promising results. So this is a market in an area where new technologies are being utilized very effectively, and this is the way to train healthcare professionals from the simplest, how to take a blood pressure properly, all the way up to the most advanced treatments that are available these days. So there's a lot of opportunity in the emerging market areas for the areas of distance learning, e-learning, and any type of public health initiative to really educate healthcare professionals, doctors, nurses, any type of healthcare professional. So taking a few moments to consider what would you want to consider when you are planning a global program? Because while I have said to all of you that a true global program probably doesn't really exist in a pure form, but many times we want to take the science, the best practice, and we do want to make it available on a global level. And it's much more cost effective to do that, those types of things. So a few things to consider if you are planning a global program are the following. Think about your planning committee. Who's on that? Are they key opinion leaders? Are they local community people? Are they society people? You want to make sure that you have representation from any area that you are targeting from, and make sure that you're aligned with the local or regional customs and guidelines. Partnerships. If you do not happen to be in an organization that has offices or locations throughout the globe, it's extremely beneficial to partner with different organizations. It can be another MedComms agency, it can be societies, it can be even other healthcare professionals in that area. Localization, again, is very, very important, and this goes beyond translation, but ensuring that all the local guidelines are upheld. Local codes, local laws, guidelines and accreditation bodies, they're separate, they're different. Talk to all of them. It's very, very important for the overall success of your global program. And it is an opportunity to bring good education, good science to a very, very large audience. I want to thank you for your time today, and this is my information should you have any questions. Thank you.